Welcome to Anatomy of Life, where we explore the incredible systems that keep the human body alive. From the brain and heart to hormones, organs, and disease, we break down complex medical science into clear, fascinating stories about how your body works. Because understanding your body is the first step to protecting your health. This is Anatomy of Life. What is a stroke? Stroke occurs when blood flow to part of the brain is interrupted or severely reduced. Without oxygen-rich blood, brain cells begin to die within minutes. The brain depends on a constant supply of oxygen and nutrients delivered through blood vessels. When these vessels become blocked or burst, the affected area of the brain begins to shut down. There are two major types of stroke: ischemic stroke. This is the most common type, accounting for nearly 87% of all strokes. An ischemic stroke happens when a blood clot blocks an artery supplying the brain. Hemorrhagic stroke. This occurs when a blood vessel ruptures and bleeds into or around the brain. The escaping blood increases pressure inside the skull and damages delicate brain tissue. There's also something called a transient ischemic attack, or TIA. Often called a mini stroke, a TIA temporarily blocks blood flow to the brain. Symptoms may disappear within minutes or hours. But a TIA is a major warning sign that a larger stroke could happen soon. Over time, cholesterol, fat, calcium, and inflammatory cells narrow the vessel. Eventually, a clot can form at the site. Sometimes the clot develops elsewhere in the body and travels to the brain. This is called an embolism. One common source is the heart. In atrial fibrillation, an irregular heartbeat, blood may pool and clot inside the heart chambers. The clot can then break free and travel upward into the brain. Once the artery becomes blocked, oxygen delivery stops. Brain cells switch into survival mode. Within minutes, energy production fails. Neurons stop functioning. Toxic chemicals accumulate. Inflammation spreads. Brain tissue begins dying. The core area suffers irreversible damage quickly. Around it lies a vulnerable zone called the ischemic penumbra. This tissue is injured but still potentially salvageable if blood flow is restored rapidly. That is why emergency treatment is critical. Unlike ischemic strokes, hemorrhagic strokes involve bleeding. A weakened blood vessel ruptures and spills blood into surrounding brain tissue. The two major forms are intracerebral hemorrhage, subarachnoid hemorrhage. Intracerebral hemorrhage occurs inside brain tissue itself. Subarachnoid hemorrhage occurs in the space surrounding the brain. One major cause is uncontrolled high blood pressure. Over time, hypertension weakens artery walls. Another cause is aneurysm formation. An aneurysm is a balloon-like bulge in a blood vessel. If it ruptures, massive bleeding can occur suddenly. Symptoms of hemorrhagic stroke may include sudden severe headache, vomiting, loss of consciousness, seizures, confusion, weakness. As blood accumulates, pressure inside the skull rises dangerously. The brain may become compressed. In severe cases, parts of the brain can shift downward, a life-threatening condition called brain herniation. Diagnosis and emergency treatment. When a patient arrives at the hospital with stroke symptoms, doctors must act fast. The first priority is determining whether the stroke is ischemic or hemorrhagic. A CT scan can quickly identify bleeding. This is critical because treatments differ dramatically. For ischemic stroke, doctors may use a clot-busting drug called tissue plasminogen activator, or TPA. TPA dissolves clots and restores blood flow, but it must be given within a limited time window. In some cases, doctors perform mechanical thrombectomy. A catheter is guided through blood vessels to physically remove the clot. For hemorrhagic stroke, treatment focuses on controlling bleeding and reducing pressure. This may involve blood pressure management, surgery, draining excess blood, repairing aneurysms. In stroke care, speed changes outcomes. Recovery and rehabilitation. Surviving a stroke is only the beginning. Recovery can take months or even years. Some patients regain most of their abilities. Others face lifelong disability. The effects depend on the location of damage, the size of the stroke, how quickly treatment began. Rehabilitation may involve physical therapy, occupational therapy, speech therapy, cognitive rehabilitation. One of the brain's most remarkable abilities is neuroplasticity. This means the brain can reorganize itself and form new neural connections. Healthy areas may partially take over functions lost after injury. Recovery requires repetition, patience, and determination. For many survivors, even small victories become major milestones. Risk factors and prevention. Many strokes are preventable. The biggest risk factor is high blood pressure. Other major risks include smoking, diabetes, obesity, high cholesterol, lack of exercise, excess alcohol use, heart disease, atrial fibrillation. Age increases stroke risk. But strokes can happen at any age, even in young adults. Prevention strategies include controlling blood pressure, eating a healthy diet, exercising regularly, avoiding tobacco, managing diabetes, reducing stress, taking prescribed medications properly. Protecting your blood vessels protects your brain. A stroke can change a life in seconds, but knowledge saves lives. Recognizing symptoms early, seeking emergency treatment immediately, and protecting your health before disaster strikes can make all the difference. The brain is the control center of human life, and every heartbeat, every movement, every memory depends on its survival. If you found this video helpful, subscribe to Anatomy of Life for more in-depth medical documentaries exploring the incredible systems of the human body. And remember, your brain depends on every second.